Hello, today I am here with my patient GC, who was admitted to a skilled nursing facility following surgery of a genitourinary obstruction. This resulted in generalized muscle weakness, and he presented with shortness of breath or dyspnea upon admission related to his COPD. Before patient was admitted, he was living at home with his wife, and he was able to ambulate with a walker by himself, and he was ambulating with 4 liters of continuous oxygen per minute, and he was resting with 3 liters of continuous oxygen per minute. Now, unfortunately, in the SNF, he has gone up to 6 liters per minute while resting and 10 liters per minute while ambulating. And he can currently only ambulate 5 steps with his walker before experiencing dyspnea-related distress. I assess this patient's learning needs by administering a multiple intelligences questionnaire and determine that GC learns best through reading and kinesthetics. The education model that I implemented is called the Pender Health Promotion Model, and this model focuses on self-efficacy. This model is appropriate for my patient because he is ready and willing to learn alternate breathing techniques that will help him manage the symptoms of his COPD. These are things that he will be able to do by himself without the help of respiratory, a nurse, physical therapy, or occupational therapy. So I am going to share with him a few techniques. Okay, so the first technique, so I'm just going to give you a little background on COPD in general. So COPD is an inflammatory response of the lungs caused by toxic particles and gases that consequently affect other body systems. And some common symptoms are shortness of breath, coughing and wheezing, mucus in the throat and the cough, and chronic or frequent respiratory infections. This can be caused by smoking or exposure to noxious gases or air pollution. So the first technique that I'm going to go over with you is pursed lip breathing. So to do pursed lip breathing, we're going to close our mouth and we're going to inhale sharply for 4 seconds through the nose. And then breathe out through pursed lips. Again. Okay. And the second technique that I will be teaching you is called pranayama yoga breathing. It's a yogic breathing technique that helps open up the airways. And this is something, all of these exercises are things that you can just do while you're sitting in bed or while you're sitting in your wheelchair. They're self-motivated. So to do this, we're going to start by covering our right nostril with our thumb, and we're going to inhale for 4 seconds. Then we're going to move our ring finger to our left nostril and breathe out for 4 seconds. And then we're going to move our right thumb back and do the same thing. And this will help open up the airways. And you can do this while you're sitting in bed or practicing yoga. So the last one that I'm going to teach you is just a simple yoga sequence that you can once again do while you're sitting in your chair or on the edge of the bed. And to start, we're going to lift up our arms. We're going to lean to the side. We're going to come to the middle, lean to the side, lean down to the center. And then we're going to come back up. All the while, make sure that you're practicing active breathing. And then lastly, I am going to show you a monthly step log. So when you go to your physical therapy meetings, you're going to be wearing a pedometer, and this will help keep you accountable for the amount of steps you can take, hopefully increasing your steps every day. Right now, you currently are able to take 5 steps with a walker, and with this log, you can track your daily steps and set a monthly goal. All right, do you have any questions?
I do not.
Okay, great. All right, so my patient will be evaluated based on the completion of the daily exercises described and by documenting the steps in his monthly log. This education plan should result in a decrease in dyspnea-related distress and less oxygen desaturation while ambulating and while resting, and a total increase in the amount of steps that he can take every month. Thank you.